Federal investigators say a nurse denied multiple requests to take an 8-year-old migrant girl to the hospital on the same day she died in U.S. Border Patrol custody in Texas.
Anadith Tanay Reyes Alvarez suffered from sickle cell anemia and heart disease. She died last month. U.S. Customs and Border Protection released a statement that said in part, quote, despite the girl's condition, her mother's concerns, and the series of treatments required to manage her condition, contract medical personnel did not transfer her to a hospital for higher level care.
Nick Miroff joins us now. He covers immigration enforcement and the Department of Homeland Security for the Washington Post. Nick, what have we learned regarding the hospital requests and the girl's interactions with the nurse?
Well, it sounds like a really nightmarish tragedy. The incident remains under investigation, but U.S. Customs and Border Protection says that this nurse practitioner saw the child multiple times and denied repeated requests from her mother to call an ambulance, even as the girl's condition worsened. It also appears that the nurse practitioner, who was a contracted medical staff there, it appears that she did not review documents brought by the family outlining the girl's fragile medical history.
I mean, Nick, so many open questions right now. Do we know at this point what treatment this girl did receive?
She was administered over-the-counter medicines for the most part. You know, she was diagnosed with flu. She was given, pain relievers, ice, that type of thing. But we know now that her fever at one point, the day before she passed away, had spiked to nearly 105 degrees. Why that didn't raise alarms for these medical contractors is part of that investigation. But as any parent can imagine, this is truly a horrible scenario in which you know that your child needs urgent attention and you're in custody and you're being denied it.
So, Nick, what changes are DHS officials making to protect people who are currently in Border Patrol custody and to make sure this doesn't happen again?
Well, border officials have ordered a full review of every case of any fragile medical case within the system along the entire border. They're reviewing their practices, and they've taken steps to make sure that this medical contractor doesn't work with CBP in the future. And as for the standards of care, I think, what this really underscores is that when there are lots of people in Border Patrol custody in these Border Patrol stations that really aren't set up for families and children, that these are the types of risks that can lead to tragedy.
Nick, I wonder, you mentioned that at one point the girl's temperature was 104.9, I mean, almost 105 degrees. And it would seem that that is a red flag. You don't have to be a trained, medical professional to understand the dire situation that a person, especially a child, is in that kind of scenario. So I wonder, could this nurse practitioner face charges? Because it seemed that there were multiple opportunities, as you pointed out, and as the reporting suggests, for her to get that emergency care immediately to this child.
All of that remains under investigation, but I would point out that this Border Patrol station where the girl was being held with her family was designated as the location for sensitive medical cases of this kind. So if this was the type of attention that the agency was able to provide, it's really scary and frankly unfathomable why someone with a medical background wouldn't recognize the risks of having a young girl in this state, especially when you're not even reviewing her medical files.
Such a disturbing case. Nick Miroff. Nick, thank you.
Thank you.